Screen. Should we just mute ourselves?
Hi everyone, we're just giving ourselves a moment to get started with this webinar. If you could just bear with us for 2 minutes, we're just sorting out some technical difficulties from our side. We should be up and running in about 2 to 3 minutes. Just give us one moment to get that sorted. Thank you guys.
All right.
Hi everyone, thank you so much for your patience. Sorry, it's blurred you.
That's fine. Thanks everyone for joining us on a Wednesday evening. Sorry about the technical issues, just bear with us. We're going to get started. I just want to introduce myself. My name's Pratiksha. I'm a GP and clinical advisor at Lyrebird. I'll let Lily introduce herself, but it is her birthday today. So she's taking her Wednesday night out to help all of us learn how to use Lyrebird and get the most out of it. So give it up for Lily.
Wonderful. Thank you so much for that intro. So we've got a few things on the agenda today. So it's essentially this is your evening. This is your space to ask any questions that you might have about Lyrebird. Dr. Pratiksha is here to answer some questions. She's going to be monitoring the chat tonight. So if anyone has any chats at all or questions about how to use Lyrebird, how to get everything functioning, or any specific questions that you might have about anything really, what could we
Yeah.
cover? Like,
We'll try what we're going to do. I'll ask you a few questions just to gauge where you're all at so we can pitch it accordingly. We do also run this every week. So if there's things that we don't cover, we can do that another time when you're able to join us. And also we'll show you how to contact support, who can also help you. So Lily is one of our sales team. Normally I do this with Matilda, who's support. So she does a lot of troubleshooting with us. We might not be able to do all of that today, but Matilda will be back with me next week. So before I start, can I just get an idea of, and you can pop this in the chat, please. Can I get an idea of how many of you are new users? So you've only kind of been using it the last few weeks, or even just signed up today, versus how many people are more experienced users? Okay, so new user, perfect. Okay, great. So lots of new users. So we will definitely kind of go right down to the basics and show you right from the start how to use Lyrebird, launch it, do a consult, do the basics of like a referral letter, a care plan. I'd also like to know, are there people out there who are BP free users or BP Pro users? If you could put that in the chat as well, so we can highlight any features that would be useful to you, that would be really helpful.
okay, we'll just wait for a few more answers to come in if there are any. Okay, so we've got some BP free users.
Yep. And the BP free users, are you integrated with best practice, fully integrated with best practice? That would be also really helpful to know. You can keep typing those answers into the chat, and I'll monitor that. Also type any questions into the chat. But what I'll let Lily do is start by just starting from the very basics, how to use Lyrebird, and then we'll go jumping into a Q&A.
Mm-hmm.
Lead the way.
Fantastic. So thank you all again for joining tonight. Apologies for the blur in the background. We will get that sorted in no time. Few technical issues tonight. But essentially, what we're going to be showing today is how you can really begin using Lyrebird. So we'll start from the very basics. So we'll start with how to open Lyrebird within best practice, where it is going to be, a basic consult, and then we can move into things like referral letters, patient notes, and then we can take it a step up and from there move into our workflows. So a workflow for us is a CCMP, so a GP CCMP, as well as our mental health care plans. So in just a moment, I can get started today and I can share my screen. We've got a practice version of best practice, and none of this is real patient information, but I'll get it started and show you how it all functions. And then feel free to put any of your questions in the chat as well. Okay, wonderful. Are you all seeing best practice? Yep. Fantastic. So you're all very familiar with this. You know how it all functions and works together. Lyrebird is fully integrated and it must be within a patient file. You have to open a patient file to get access to Lyrebird. And I'd recommend in those early stages when you're just beginning to use Lyrebird that you use a test patient to really get started. So if you don't have one, please try and set one up. So we have a patient called Margaret Hill. I'm going to open her file. We'll give it a moment. There we go. You can see we've got quite a variety of information here. She's a really complex patient. Again, not a real patient. It's all pretend. And we have an L icon at the very top. This is your Lyrebird scribe. And if any of you have not yet signed up to use this, I recommend that you don't sign up via our website. The best way to start using it on best practice is to sign up via best practice. This is making sure that you're logged in fully. It's all working properly and you're fully integrated and it's pulling patient info from best practice. So as soon as I open this, just one click, you'll see that Margaret Hill's info is coming up.
So what that means, it's the integration means that yeah, it's all coming up there. But when you want to do a referral letter, when you want to do a GP CCMP, all of that information is pulled across
Mhm.
into those documents, and you don't have to manually do any of that. And we will demo those shortly, but before we do that, we'll just maybe do a
Basic.
practice consult.
Yep, fantastic. So we're going to do a bit of a role play of a practice consult with myself as the patient. Is that okay?
Yeah, absolutely.
You are a clinical doctor, so let's do that. Let's stick to what we know. Wonderful. So we're going to start by obtaining consent and start listening. You do need to obtain verbal consent from the patient every time. And we have our microphone started. So as soon as you begin, we can see that there's some blue lines moving at the top. That's how you absolutely know that your microphone is working and it's picking up what is being said in the consult room. We also have telehealth settings as well for this, and that we'll run you through that later. If it disappears like this, all you need to do is click back on the L icon. We have a patient summary here. This info will not automatically come through to your notes. If you are wanting to pull it through to your notes, are you okay if I add some info just
Yeah.
off the bat? You can just highlight and then copy, Control C, and paste it into this box at the bottom.
So you're using Notepad there. Can you explain to everyone kind of
Absolutely. So the Notepad feature is a tab that you can see here, and it's where you want to enter non-verbalized notes and you can add additional context. So I've added the context of medications from the patient summary tab into the Notepad.
the thing I use it for a lot is mental health consults, for example. So you might want to do a mental state examination. And for most examinations, like you'll see in the mock consult, I just speak out the examination findings out loud. But what you can do is just literally write down, mental state examination, appearance, behavior, things that you might not want to verbalize in the consult, and it will still be incorporated into your notes.
Wonderful. So you can see that Dr. Pratiksha said mental health care plan here. And so it's picked up that she wanted to start a mental health care plan, but we're actually going to dismiss that for now and just focus on a basic consult. So would you like to begin?
Hi, Margaret. Happy birthday. How can I help today? Was it your knee?
Yeah, actually, yeah. So I indicated on my form that my knee is really bothering me. I was out
Okay.
playing netball with my friends about a week ago. I kind of twisted quite weird on that knee, and it's still really swollen. You know, I can
Yeah.
still walk a bit, but I'm just really struggling. Do you think I should see a physio?
Yeah, that's a really good question. I'll maybe just have a look at your knee
Hmm.
first. Which knee was it?
It was the left knee.
Your left knee. Okay. So I won't do the full consult. You guys know how to do a consult, but I'm just showing you for demo purposes. Okay, so Lily, so Margaret, your left knee I can see is quite swollen and tender. You've got reduced range of motion. It's not hot, it's not red, and there's joint line tenderness on examination. So in answer to your question, there's a few things you could do. So for example, you could ice it, you could try some painkillers if you haven't already. we might need to consider doing some imaging for you, but absolutely a physio would be a good idea. And I can see that you've had x-rays in the past that also show actually that you already had osteoarthritis in
Mm-hmm.
your knee. So another thing that we might want to consider is, given that your knee was already really bad, do you want to see an orthopedic surgeon if things aren't calming down? And I know
Mm.
this is just a acute injury, but that would be something to consider as well.
Okay, yeah, that sounds really reasonable to at least send those referrals off and see what,
Yeah.
an orthopedic surgeon would say. And I'm really happy with the physio referral. How many sessions do you think I might need?
Look, you're eligible for 5 sessions per
Okay,
year, so I'll leave that up to you depending on how the progress is
okay.
going. So we might just kind of pause there,
Mm-hmm.
and from that consult, again, this is just for demo purposes, but we wanted to show you how to generate 3 documents here. So the first one would be the GP for a physio. The second one would be an orthopedic referral, and the third one could be like a patient letter. So we'll just talk you through those if that's okay.
Mm-hmm.
Yeah.
So we can start with should we start with the standard referral letters? We can stop the consult, actually, instead of resuming, and we can create our referral letters.
Actually, before we do that, the actual console itself, you can see here what's been generated, and you can actually just you should always check this and make sure you're happy with the content. Make any amendments if there's any errors, um, and then you can kind of add any information as well that you need to. As you can see, I spoke the examination out loud, so I don't need to type anything. It's already there. We're very happy with what's been documented there. And once you're happy, you can just click save to best practice, and that's your consult notes
Mm-hmm.
done. So that's that one done.
Yep, great. While we're here, we may just create a few referral letters so you can see that process. So I will point out if I were to push the Save to BP button, it does close down Lyrebird, but you can retrieve those consults, which we can cover it at a point soon. Um, so I will just show you how we can create sort of a physio referral. We'll start very simple, and you need to search for a document. So we're going to search for a physiotherapist. We're going to use one of our best practice referral letters. So this is using our default letterheads, and we can make sure that you're able to set up your letterheads, your practice letterheads. So we've got Lyrebird Health, and we'll wait for everything to load. Generating 2 of 4 sections.
And then I guess we won't show you an orthopedic referral as well. It's the same concept,
Mm-hmm.
but you can see that it's pulled the context from the consult that we just had. It's also pulled the past medical history, the medication. So that's all already there because we're fully integrated into best practice.
Mm-hmm. And from here, you can add your addressee. And I'm going to add a physio via HealthShare. It does sync with your best practice contacts. Just going to search for a random physio. Great. And you can write the referral here. And it's added that referrals info. From here, we can save to BP.
And again, you can edit beforehand. Yeah.
Of course, you can type in here as needed. And then you can save the notes to BP also. So I'll show you how that displays. We've got today's notes. And then if you go to correspondence out, your referral letters will not show until you refresh best practice. This is either by clicking F5 or clicking on view, and then refresh.
So that's amazing. We just spoke and we've done about 2 or 3 clicks. Our consult notes have been
Mhm.
saved and the referral letter's already done as well.
Mhm.
Great.
All done, just like that, ready to send. Okay,
So I hope everyone's okay with referral letters. We'll now move on to a GPCCMP for the
perfect.
physio.
Fantastic. So we'll open that scribe again. And I'll going to just show you the history tab, and we can actually resume the past consult and pick things right back up where we were.
So we've closed it
Mhm.
and you're showing everyone how to go back into it. Thank you.
So we have the history here, and we can see we had Margaret Hill as a consult from tonight, and it's set to expire tomorrow. As soon as you try and go into the history section of Lyrebird, it's going to ask you how long you want to store this info from. So that is your consult transcript, notes, and any documents. So I'm going to open that right up. And what we can actually do is start a GP CCMP by clicking resume. All right, we've got a GP CCMP right here, but we can also show more. So this is a complete list of every workflow that we have on offer. We've got CCMP reviews, we've got mental health care plans, 75 plus, but we're just going to start this initial GP CCMP right here.
Just before you do
Of
that, when you say workflow, I'll just clarify,
course.
bit of an internal word, but what we mean
Yes.
by workflow is health assessments. So you've got your 699, you've got the menopause health assessment, you've got the 75 plus, you've got the 701, 703, all of those item numbers. We also mean the Aboriginal health assessments, all of the health assessments. And then also care plans and care plan reviews. So 965, 967 mental health care plans. So 2715, 2717. Um, I think that about covers it, but that's what we mean. And if you haven't ever looked at the right-hand column, it is really helpful. There's basically that information there to remind you, help you, prompt you. And as we've also already demonstrated, it sometimes listens and will suggest a workflow based on what you've already
Hmm.
talked about. But yeah, I'll let you carry on. So it's as
Okay,
simple as clicking on start.
just like that. This is just indicating to the tool that you want to start a GP CCMP. It's giving you those key points that you need to hit. So diagnoses and relevant conditions, patient goals, actions, treatments, and referrals, as well as the further review arrangements. Following this, it's going to create a PDF that can then be saved into best practice.
Now, what I didn't do in the consult, this is my bad, I didn't actually discuss goals with this specific patient, but whatever we have decided on in the consult is what will be pulled and put into the goals there. So, I would have said something like knee strengthening, reducing pain, and that would be put into the goals.
Okay, so yeah, knee strengthening, reducing pain. We're going to do the referral to a physio for those 5 sessions. And actions for the patient are to, yeah, seek that physio referral and continue resting. And when should they come back for review?
So I'll add another goal. Did you do it playing netball?
Yes, I
So
did.
when would you like to get back to playing netball pain-free?
As soon as possible, but I'm thinking in the next month.
Oh,
Bit soon?
I think so. I think that might be tricky. Maybe we
Mm,
work to getting back to like 50% in six
perfect.
weeks and maybe back to baseline in like 3 months, and we
Perfect.
can review where you're at in 3 months.
Wonderful. That sounds fantastic.
Right.
All right. Is there anything else we need to cover for this GPCCMP?
So actions for the patient, go and see the physio, pain management, imaging, icing it, resting it, review in 3 months, and consider orthopedic surgeon.
Fantastic.
Great.
From there, we can just push stop. Okay. It's now generated our CCMP ready for review.
I've just had a comment in the chat. Can we slow down with how we're showing how to
Mhm.
save things to best practice?
Of course.
We can re-show you again, but with this one, we'll slow down.
Okay, it looks like potentially, can you all see the blue buttons at the bottom of the GPCCMP on the right-hand side, or is it potentially cut off? Let me see if I can alter this screen sharing slightly to fix it. One
So
moment.
what Lily's showing you is on the, yeah, show them this one.
Okay.
So that icon there, save to best practice, is what you're going to click on for saving the actual consult notes. It's not quite on screen. There's another button just being cut off on the right-hand side. Can you scroll down maybe?
Yeah. Still not appearing.
Okay, it's
See
slightly
if I
cut
can.
off, unfortunately, but literally just underneath where Lily stops scrolling, there's a button that says save to best practice again.
Mhm.
So,
So potentially, would you be able to put your screen on full screen and we can see if it's.
yeah.
Oh,
Oh, there we
great.
go.
You can
Yes,
see
you
it.
can
Sorry,
see
it's
it.
our
Great.
view. Okay, wonderful. So it's the two save to BP buttons at the bottom, and I'm just going to take a scroll through this GP CCMP slowly so you can all see how it appears, and I'll flag a few things here as well. So you can see it pulls prior care plan details and relevant history from best practice. And it's add the acute left knee injury here. We've got today's knee injury. She had a relevant CCMP for other conditions. We don't have to cover that right now.
I will just flag
Mhm.
the reason those goals are in there, even though we haven't verbalized them, it's not just making up random goals. This is a test patient who we have done so many care plans on, probably even just today. So it's pulling that information based on that. It's not going to randomly generate goals for conditions that you haven't discussed in the consult. So just for reassurance. So you can take those out and amend them accordingly, but they're there because they've been discussed earlier today in another practice session.
Mhm. I'll keep scrolling and we can take a look at everything that comes through. Required treatment.
So again, you can tweak anything you need to. We've already generated the referral letters, but if we hadn't, that's another way of doing that. But once you're happy with everything that's on there, again, it's just clicking save to best practice.
Fantastic. So we'll save this. Scroll right down to the bottom. We'll save to BP.
And I know a lot of you are new users, so you may not have come to this stage yet, but when you've done a 965, i.e. a GPCCMP in Lyrebird, when you come to do your 967, which is the GPCCMP review, it does take that into account and pull that information so you can review previous goals.
Mhm. Fantastic. So we'll save the notes again as well.
And yes, we will be sharing the video recording as
Mhm.
well. Yes.
Great. And then I'll show you how the CCMP loads in correspondence out. So we need to refresh it again.
So if you think about how this would have looked like before Lyrebird in your practice, it might have been using nurse time or you're doing heaps and heaps of typing and filling out the template. This was all done just by you talking to the
Mhm.
patient, and it's literally just a few clicks, couple of changes if you need to make them. We haven't really need to do anything differently, and it's all done there for you, and the document's ready to go. Okay, so I hope that those are clear. Um, I'll move on. What do I click on to refresh? So you can either press F5 or,
You and then refresh.
and then you'll see it in correspondence out.
Mhm. So you can see there's been a significant number of CCMPs done for this patient in the past few days. So Margaret, that's why there are so many goals that have come through. It's because she's got a huge number. Okay, fantastic.
Um, I think this is really quick, so we'll show you one last kind of thing that we can generate from that consult,
Mhm.
which is a patient note.
Perfect.
I don't know if you all know that this feature exists, but for example, a patient might want a summary of what you've discussed. It's a lot to take in, or you might use this in a complex patient or an elderly patient, or sending it to family or something like that. So you can send a letter to the patient, basically.
Mhm. So we can reopen Lyrebird and reopen that consult again and resume it. Go to history at the top. We'll open up Margaret's consult and then we can just create a new document. Do a patient letter. Is that the feature you had in mind? Was the patient letter?
Yes.
Perfect.
Yeah, so it just summarizes in like plain language. I know this was a really basic consult, but I just
Mhm.
wanted to demonstrate that feature exists.
And it can be shared directly to patient by putting the patient's email address here also. I'll show that process one more time. You just simply create document, search for patient letter at the top, select it, and at the bottom, you'll be able to create one document. And from there, you share to patient. That's it.
Perfect. And then if everyone's happy with that, we'll show you a demo of a mental health care plan,
Perfect.
which Lyrebird is trying to make us do several times today, so we'll give
Yes.
in.
We've mentioned it a few times, and so it is going to pick up what you say in a consult and it's going to make a suggestion. And so it's continually suggested mental health care plan for us today. So we'll start that one again. So again, you can pull it up here. Even if we didn't mention mental health care plan, it'll be appearing here on the right-hand side. You can just click on it to pull up everything here. So I'll start with showing you the default. So essentially you need to click this blue text to show sections. This is going to show every part of that mental health care plan that needs to be completed. And we also have the DAS 21 assessment, which you can either send to the patient's mobile phone or you can open it up within best practice in a browser. So I think I should do that today and I'll just show you how that all displays
Yep.
and sends back to Lyrebird.
And then that answer is integrated into your mental health care plan, which is great.
So I'm going to select 1 and 0 for every answer just in the nature of time, but I'll show you, I'll go through slowly so you can see you don't need to push continue on the bottom. It just auto goes through. You can jump back a step if needed if the patient changes their answer.
You can also choose not to use it if you've already got them to fill it in beforehand, but just to show you how it works.
Definitely. Yeah, it's an optional element. Fantastic. Now from here, we just shut down this window and we can now see the dust, sorry, it's disappeared. Again, if it disappears, you just click on the L icon. It's calculated the DAS 21 scores here for you. So I've got a 4 for depression, a 12 for anxiety, and a 10 for stress. And the completed form is now sitting in your correspondence out.
Perfect. And then how does the actual mental health care plan work?
Yeah, so essentially you just have a consult and it's going to fill out for you. So are you okay if we do again where I'm the patient, you're the doctor?
Hi Margaret, what's been going on? How can I help? I saw that you've been having some stress at work and it's triggered some anxiety.
Yes, definitely. So I have a pre-existing diagnosis of anxiety, and 3 years ago, I got a mental health care plan for the first time. I really benefited from seeing a psychologist at that point in time. I got some fantastic coping strategies. I'm not on any medication, but I'd really just love the same thing again, to get that referral to a psychologist. I'm really stressed with work, and I'd really just love for that referral to happen so that I can get a few sessions.
Yeah. Tell me a bit more about the stress.
Mm.
And then tell me, you said coping strategies. Tell me about kind of your goals for what you want to achieve.
Yeah, look, work is occupying a lot of my thoughts. I'm thinking about it constantly on the weekends and I'm working quite long hours. It's an okay job, but the environment's not very friendly, not very social, and I'm really struggling with that aspect of things. I'm a very social person and there's no big issues that I've encountered, but I really just think that work is occupying too much of my thoughts right now. I'm getting quite stressed about the workload and the long hours. Um, and I really just think I'd benefit from some sessions to talk about it and understand what boundaries I need to be putting in place in my life.
So work boundaries, work-life balance, strategies to
Definitely.
manage that anxiety.
Definitely.
Yeah, no, we can definitely do that. Yeah. And you do your risk assessment, you do your mental state. Like I said before, you can use a notepad for that. Obviously, a mental health care plan would run much longer than that, and you would be doing much more of a history and formulation. But again, you all know how to do that. So just in the interest of generating the document and showing you what it looks like.
What we can do now is just push stop and watch how it develops.
If there's any features or questions that you want us to show you, please start popping them into the chat. Otherwise, we'll continue demoing a couple of things that we think would be helpful to you all.
You can type and edit in here as needed as well. Great, and it's written up the letter to a psychologist at the same time. And we have our notes done as well, and it's input the DUS 21 information. What we can do here is review and finalize and save the correspondence out. And we can save our notes also. So we'll jump back to today's notes and we can see our mental health care plan notes are there. Great. And then we have correspondence out and we can refresh. We should be able to see two documents. We should be able to see the DUS 21 and the mental health care plan. Here we go.
Great. Thank you for showing us that.
Great.
Perfect.
That's it.
I actually have a really good question, which I think is a good point to bring this up now. The question is, do you need a subscription to fully utilize Lyrebird? So I'm going to answer one part of this and then I'll let Lily talk about BP free versus BP Pro. I'm not sure if you mean subscription to fully utilize in terms of integration. No is the answer to that. So BP free, which means you can use the scribe aspect, is open to anyone who's got best practice. For you to be fully integrated and be able to use to be able to have the patient data come up, you need to get your clinic to integrate, and you can call your IT department or speak to your practice manager if you haven't done that. That gives you the best in terms of integration features, but that's a slightly different question to getting the most out of Lyrebird. So can you explain BP free versus BP Pro?
Absolutely. So there's a really clear difference between BP free and BP Pro. So BP free gives you access to those unlimited consult notes. You can create them, edit them, customize them as much as you need, and still save them to best practice. With our free membership, you get 10 documents per month. So that is the creation of 10 referral letters, 10 patient letters, things like that. That will add itself, you'll refresh the 10 documents based on the day that you signed up for an account. They don't stack up month to month. So if you use 5 one month, you won't have 15 the next month. It's just 10 per month. And then for workflow, so for your CCMPs, for your mental health care plans, anything that appeared on that right-hand side, you have a lifetime limit of 20 of those. You can all access a 2-week pro trial where you can really make the most out of them before using up those 20 or 10 documents, which I'd really recommend you all take up to understand the impact that Lyrebird can have on your day-to-day. As part of that, we can set up some further training and customization as you need, so that you really are able to make the most out of that time.
And as we've shown you today, the referral letters, it's so easy. You don't need to type anything. It's just a few clicks. And same with the GP CCMPs and mental health care plans, which can take up a lot of time, but also with the latter, a lot of cognitive load. So it just streamlines all of that for you.
Yep.
So definitely try it out so you can see how you can utilize that day to day.
Wonderful.
Um,
More questions that we need to pick up on?
I've answered a couple of these questions in the chat. Does it put DAS into observations? Don't
No,
believe it does.
not
No.
straight away, not automatically. Observations, it does record a lot, and there'll be a pop-up that appears
Hmm.
for you to then save it. For Dust 21, no, not automatically. But we can pass it on to the team as a suggestion.
Yeah, if you'd like to see
Hmm.
that done, we can definitely look into it. But that does segue into what observations it does record. So as I showed you already, an examination and how that's documented. If I was to do, well, why don't we do it
Yeah,
actually?
why don't we do it? I think it's best to see it in action.
Yeah. So I'll just do maybe like a sore throat so I can talk about some obs.
Okay, great.
Hi, Margaret, how are you today?
Yeah. I've got a really sore throat at the moment. I'm feeling quite unwell at the
Oh,
moment.
I'm sorry to hear that.
Mm.
Just a few questions.
Mhm.
Do you feel like you have a fever at all?
I do feel like I have a fever at the moment.
Yeah,
Mm.
and do you feel like there's any like pus on your tonsils, white spots? Not sure.
Potentially a little bit. I've never had tonsillitis or anything like that, so I'm not sure at the moment, but I'm
Sure.
definitely not feeling well.
Any cough?
No cough at the moment.
Okay, any breathing difficulties or anything?
No, just quite feverish with a sore throat. I think I
Okay.
might like be, it's a little bit of sinus pressure, but that's okay at the moment.
Okay. Okay, so let's just examine you, Margaret.
Hmm.
Temperature, gosh, okay, 38.4. You definitely have a temperature. What are your oxygen levels looking like? Okay, 99%.
Hmm.
Your pulse rate is 108. Okay, and your throat looks very, very red, and there's lots of white exudate bilaterally. There's no quinsy, your uvula central. There's some raised cervical lymph nodes, and your chest is clear. So it looks like you have a bit of bacterial
Hmm.
tonsillitis. We're going to have to give you some antibiotics, and I'll give you some time off work as well.
Fantastic. Thank you so much.
So you can see these will be automatically entered into observation. When you click Save to BP, it comes up with this. So you can amend it if you need to. I didn't do a blood pressure, but again, that would have just been documented. I don't think I enunciated clearly enough. It didn't hear me say oxygen saturation properly. So you can add in if it's missed something,
Hmm.
but otherwise it's pulled everything that I said into the from the console into here, and it will save to observations.
Here we go.
Great question. Okay, you can see all the observations there.
Here we go.
I have a question. Does Lyrebird pick up different languages?
Great question. Let
Yeah.
me show you right now. It absolutely can. Um, Unfortunately, we don't support bilingual consults, but we have multiple language options with the output being in English. So these are the languages. The dark ones are the ones that you can automatically turn on yourself. Grayed out ones, you will need to contact our support team to get that switched on for you.
That's just because we're still tweaking and
Yes.
finalizing. But if you particularly want a language, please reach out so we
Hmm.
can turn it on for you.
So if I were to turn on Spanish, the output notes and obs, everything will still be in English. But if you are switching on a language, you can't have a bilingual. It's not going to be as accurate for picking up the consult notes. So if you are switching Spanish on, please try and keep the consult with as much Spanish as possible. So you just click on the language box up here, and I'll switch it back to English now.
I think while we're there, actually, can you also show how to do telehealth?
Fantastic. For telehealth consults, all you need to do is tick this box down here. For telehealth consults. So they're going to prompt you with some information on making sure that you are able to share the audio correctly. If any of you do telehealth consults, I'd recommend you set up a practice one and you are able to test out your microphone prior to relying on Lyrebird straight away. So performing a test is a good idea for everyone. And I'll run through that again. So I'm going to cancel out of here and close. If we go to consult, back on the landing page, you just tick the telehealth box and start the consult.
Perfect, thank
That's it.
you. What I often do as well, when it's telehealth, if it's just a phone call, I'll put people on speaker, and if you've got a good mic, you'll easily pick that up. You
Yeah.
don't need telehealth consult mode.
It's much easier to
Yeah.
do that on speakerphone and make sure that your just in-clinic mic is set up than to do the system of remote desktop and setting it up with a remote phone, remote workplace, things like that.
Matilda has an answer to this. I can't remember. Which microphone brand?
Oh, off the top of my head, I'm not sure. Any of the ones that we suggest USB connection,
Yeah,
tabletop, and it does not need to be top of the line. A very standard one from Office Max will suffice. Anything from Amazon will suffice. Just make sure that you test it
just
out
test it.
prior, read the
Test
review.
it.
The ones that we typically suggest are no more than the $40 mark, though.
Yeah,
You
I
don't need top of the
don't
line.
think I use a fancy one and it still picks up. So my clinic room's quite large. Even when I'm on the other side of the room examining a patient on the couch, it's still picking up from the microphone I have. So it doesn't have to be anything fancy, but test it out.
Hmm.
Yeah.
Fantastic.
Is there any other questions? Otherwise, I'll just do a summary and maybe start wrapping up.
Yeah. What about
So,
contacting support? We cover that?
yes, I'm going to get Lily to show you how to contact
Great.
support.
We have a fantastic support team. We've got some that work remote, but a huge number are based in our office in Melbourne. They're very, very easy to contact for any concerns you have at all. If it's a microphone issue, if you're repeatedly having to log in, it should automatically log you in via best practice. Something's not generating, you've lost half your consult, please let us know. Particularly with things like it's omitting particular words, something clinically inaccurate is turning up. We want to know, we want to hear about it. We want to make sure we're knowing that we can improve the tool. So what we can do is click the blue button at the bottom right hand corner, the speech bubble. And from there, you can send us a message. It's going to start as a triage chatbot. And from there, you can just open a ticket by saying, I'm using Lyrebird, thank you. And you give your email, say you want some support. So typically it's product support if it's a technical issue. And you can describe it and it'll connect you with a real member of our team. They normally jump on within a minute. You see, Ryan's joined, and I'm just going to say, all fine, Ryan, just showing how responsive you are.
Mhm. Um, I actually had to use this in real life um, on Monday when for some reason I disabled my microphone. And it's busy, you just want to get on with your consults. Do I have time to contact Lyrebird? I did 3 consults without Lyrebird and was like, no, I just need to get this sorted. And I contacted support and it was literally Jordan jumped on, it's fixed within 5 minutes. I can carry on with my day.
Yep, they can give you a call if you need,
Yeah.
but they can contact you by email.
Yeah.
And their support email, if you're not able to access Lyrebird at all, you can't even get access to that blue speech bubble. The email is support@lyrebirdhealth.com.
I'm going to put that in the chat. So support,
Support@lyrebirdhealth.com. Thank you.
and the hours are quite extensive, so they're there most of the time.
Hmm. I believe I think it's 5 a.m. through 9 p.m.
Yeah,
They're available, and otherwise it'll be there'll be less support, but that's when they have several team members at a time helping you.
sure.
Yeah.
Now, I don't know if this one you want to answer online. We'll answer online, but also maybe follow up with you specifically, Kamini, if that's okay. Subscription costs are on the website, but I'll get Lily to
Yep,
go through that.
definitely. So there's a bit of a difference based on what your needs are. If you're a nurse, a GP, full-time, part-time, it's best if you contact a member of our sales team, like myself, to get a accurate quote for what your needs are, how often you're using it, and your clinic size. But the typical cost for the full-time GP, excluding GST, is 1,920 annually, which breaks down to $160 a month. Typical usage we see is at least an hour of time savings a day. So if you think about it, that's really if you are just working 5 days a week, some of you might do a bit more. It may be, up to 20 hours a week, 20 hours a month just alone that is saved just by using Lyrebird. So it really does pay for itself in terms of ROI when you are using it heavily and you are able to make the most of these features.
Yeah.
But
And that's the idea of these sessions. We want
mhm.
to help you to make the most of these fantastic features that you might not yet be comfortable with, might not yet know about. So we'll be doing this again next week and
Wonderful.
can recap anything or show you more features that we haven't covered
Definitely.
today. And
Definitely.
we'll get Lily to contact you over the next few days. I mean,
Definitely. And we will be able to be in touch to let you know any further training that you might need. But we're happy to get things set up for you and make sure that you're feeling comfortable. We can answer your
yeah.
questions in individual sessions as
And
well.
for everyone actually, I know we've had this session, but if you want to book a demo,
Hmm.
how do they do that?
Yep, they can just do it via our website. So there's a book a demo link, which we can distribute with our meeting recording today. So that just gives you access to a member of our sales team. You'll get access to our calendars, so you can book a time slot of 30 minutes that suits you. And we typically do that over Zoom. And our preference is that you have started your Lyrebird account and you've got it integrated into your best practice. You've signed up. And the best way to make the most out of that time is that you join on Zoom with best practice open with the test patient and you share your screen with us and we give you that direct guidance with you leading the way. So we understand your specific needs. Great.
So someone just asked about attendance certificates. I don't believe that we do these,
Mm-hmm.
but I can look into it going forward if
Mm-hmm.
it's going to be helpful. But what you can do is you can self-log CPD. If you are RACGP members, you can always self-log this as learning. So
Mm-hmm.
definitely make use of that, and I'll try and look into that for future webinars.
Mm-hmm. Fantastic.
Okay, so today we've covered how to open Lyrebird, do a consult, do a GP CCMP, do a mental health care plan, a referral letter, a patient note. We've talked about,
We haven't talked about much about customization.
ah,
What we could do is we could cover a little bit on how you can customize your notes. Would you appreciate seeing that?
yeah, we still have a bit of time.
Yeah,
So if people are still on, we will show you how to do a template maybe in the last few minutes.
perfect.
Yeah.
Okay, what I can show you is how you can customize. You can customize anything at all. So a lot of what I hear in day to day is that GPs find that the default notes that we create are too long. We add too much detail and you want it more concise.
Or that they don't sound like
They
us.
don't sound like you. That's really common as well. Very simple way to work around this is you can actually create your very own note templates. So what you can do is create a brand new one by clicking on this here and uploading examples of what you've done in the past. And you've done this before, haven't you?
Yeah,
How
so
did you
you want to
find it?
upload like 4 or 5
Mm-hmm.
examples and it kind of gets to know you and works it out from there.
Mm-hmm.
I found it really good, but also you can be really lazy and steal other people's
Yes, you can.
templates.
You absolutely cannot actually really recommend
Yeah.
coming to our community library and taking a look, especially if your clinic has quite a specialist need. So I've added some extras myself, but we can see that we've got psychiatry, pediatric new patients, weight management. So if you've got a special need in your clinic, you've got patients that come in, maybe you're a specialist weight management clinic. What you can actually do is click on this button, add template to your account. We'll do weight management one is the name of it. Add to account. I've already got it. That's fine. We have it right here. Weight management. And it's going to create a template. Let's test it out with a mock patient. So this is what someone else has created. And I've decided that this really works for me. So what you can then do is test it out on past patients, especially if you have got examples saved.
Yeah.
Mm-hmm.
So yeah, 2 ways of doing it. You either upload your own ones, um, or steal someone else's.
Yeah.
And can we highlight the community library
Mm-hmm.
in general and the other resources there?
Yep, definitely. So we've got a huge amount of templates here available. We also have a community based on our web browser. You can't access it through best practice. Um, but essentially, in our community section on our website, which we'll also distribute in the follow-up email, you have access to it. You'll all have access to it once you sign up with Lyrebird. People can give suggestions on ways to make Lyrebird work for you. So I see all sorts of discussions of things like, I'd really love if Lyrebird could mention XYZ in a letter, like make more detailed past history and bring in something else. Someone else has already come up with a prompt for you to add. Someone's already figured out a way for you to do it. And so that is really fantastic. So we will distribute a link to that. Is that accessible via here? Sorry, I'm just going to close this down.
I don't believe this is up yet, but
No,
I
not yet.
will hopefully be uploading some videos
Mhm.
again on how to use some of these features, so you can access them offline when we're not in a webinar
Mhm.
scenario.
Great.
Cool. Okay, I'm mindful that we're almost at time. So I'd just like to thank all of you for attending and spending your Wednesday evening with us. Thank you,
Mhm.
Lily, for joining. And we'll see you again next week at the same time.
Fantastic. Thank you all so much for joining.
Thank you, everyone.